Here's an industry secret that I think you should know. Hi. Today, let's talk about hair fall, its modes of action, what its causes are, different methods of treatment, and how you can get your best possible results. What exactly is hair fall? Hair fall can be anything from a small area of loss of hair on your scalp to full-blown male pattern or female pattern hair baldness. The causes for hair fall can be scarring or non-scarring. Scarring can be because of infections or because of injuries to the area. Non-scarring causes of hair fall are loads in number, whether it is hormonal, chemical induced, whether it is male pattern hair baldness, female pattern hair baldness, whether it is because of dandruff, because of something we call alopecia areata. When you have hair fall, the first thing that you need to do is not go online and buy the next possible serum or rose oil that you can, but get a proper consult to know what the cause of hair fall is. Treating the cause of hair fall can help reduce the hair fall. Not everyone requires a transplant, not everyone requires PRP. Some people can get better even with lifestyle modifications. First thing that you need to do is find out the grade of hair fall and the cause of hair fall. There are different scales for us to check for men and for women. There are different grades on the scale that you know how much of hair fall or hair loss you actually have, so that you can find out what treatment modality would help that. But pinpointing the actual cause is pivotal to getting you the right treatment. When you are finally diagnosed with the right kind of grade of hair fall, be it grade 1 to grade 6, you have different treatment modalities. Now, what treatment is best for you depends on that. You, nothing more than that. So once we have a full assessment of what your hair fall cause is, we give you the treatment options. First is lifestyle modification, whether it is stress, whether it is alcohol, whether it is smoking, whether it is the shampoo that you're using, the water that you're using, or any other cause that may be, we can modify to try to reduce the stressing factor and thereby reduce your hair fall. The other modification that we do after your lifestyle modification is try to take care of your causative factors. If you have PCOS, if you have a thyroid condition, if you are diabetic, if you have a drug that is causing it, taking away that causative factor can help you in your hair fall journey. The next thing that we do is then move on to medical management. There are a host of drugs that we advocate for hair fall treatment. You must have heard of minoxidil, finasteride, dutasteride, spironolactone. The dosages, the treatment, the length of it, all of it is catered to you by the medical professional like us, a board certified plastic surgeon. Not everyone is going to require 3 months of a specific drug at a specific dosage. Not everyone requires oral medication. Not everyone requires topical medication. Tailoring it to you is very, very important. Once the medical treatment has begun, you usually do see some amount of hair fall in the initial stages, which scares a lot of people away. My advice is stick to the plan. If you stick to the plan, you will see results as you move forward, be it 2 months, 3 months down the line. We are here for long-term results, not for a shot in the dark. PRP, GFC, and exosomes are what are trending and very popular for treatment of your hair fall. Each one of them has a different method of action. Each one of them has a different effect, and none of these are done with a single injection. All of these are quite painless procedures to undergo because they're injected with an insulin syringe or by a derma roller after giving you local anesthetic. And PRP and GFC usually are given every 4 to 6 weeks for at least 4 to 6 sessions, along with a maintenance further. While exosomes, despite it not being FDA approved, has shown great results when given once in 3 or 6 months, maybe 2 or 3 doses, not more than that. After moving past all of these procedures for returning your hair fall or reducing the gravity of your hair fall, we move on to the holy grail, a hair transplant. A hair transplant is something that everyone has heard of, a lot of people have undergone, but very few people actually know the gravity of that procedure. Hair transplant is an outpatient procedure. It is done in a sterile operation theater. When I say outpatient procedure, it means you walk in, get it done, and walk back out. Most people who have a hair transplant do not require overnight stay. which is why it is completely done in a clinic setup. But again, please get it done with a board certified plastic surgeon or a board certified dermatologist and no one else, because getting it done with a professional who knows what to do matters more than getting it done itself. A hair transplant can be done in two ways. We call it FUT or FUE. FUE meaning we take out individual hair follicles. FUT, we take out a strip and prepare the hair follicles outside. It is a long process. It is not something that gets done in a couple of hours. Usually takes around 6 or 8 hours, done by a team of people, technicians, plastic surgeon, dermatologists, all of us collaborate on this. But you do get a break in between while we're preparing the grafts, because it has to be tailored perfectly for the areas that require the transplant. Doing a bad hair transplant gives you the worst possible results. Getting your hairline right, making sure that it is marked out in a proper fashion that is natural rather than filling up every space, is what is pivotal to this area. It is based off of geometry, based off of art and creativity for us, and for you, we have to give you the best possible results. A hair transplant post-operative, there are some conditions that you have to take care of. We give you a full-on post-operative care manual so that you can take care of when to shampoo, what to worry about, how to contact us, and everything along the way, so that you can have the best possible results and get your full head of hair back within a period of a few months. This is the tip of the iceberg. For you to get further in-depth information about hair fall, all the treatments, and about hair transplantation, don't forget to like, comment, and subscribe to our channel and follow us for more.